Hi, I'm Lucy Douglas. I'm a family nurse practitioner and owner and CEO of New Beginnings Wellness Center and Spa in Ruston, Louisiana. I want to talk about something today that might be a little difficult. I think it's a bit controversial even. I want to talk about attention deficit, both with hyperactivity and without. Certainly I'll be speaking to you about this from the viewpoint of a clinician, but I'm also coming to you as a mom. I'm coming to you as a mom who had a child with ADHD, profound ADHD. I think she came out of the womb actually wired that way. And so I just want to share my perspective, as a mother who has been down that road, and I was not a healthcare professional at that time. So I was completely dependent on the healthcare professional we were seeing, the pediatrician, to help my husband and I navigate that whole thing. It was emotional. It was hard. I felt all the feelings. I felt like a failure as a parent. I felt like somehow it was my fault even. My husband kind of told me it was, not in so many words, but it was just a complete lack of understanding. This was, 26 years ago. So certainly I think the conversations are a little easier now. Perhaps we know more, maybe the vocabulary is a little more comfortable, but 26 years ago with my 5-year-old, and that was my oldest child, it was tough. So I just want to share some pearls maybe with you. Certainly as a clinician now, having worked with children and parents for the last 7 years, but then always keeping in mind I'm a mom and I was on this journey, and part of me wishes for that time machine. Part of me wishes for that opportunity to go back now with the brain and the knowledge that I have and go back and redo some things to make my child's journey at that time easier. She's turned out to be the most amazing adult, so it's not like I have regret because we didn't have a good outcome. We do, but I there's part of me that thinks, had I known then what I know now, I probably could have made her journey easier. So my child is 3.5-ish. We're in the pediatrician's office for, I don't remember what. I think I was pregnant at that time with my second child. So I'm exhausted. I have a toddler and I'm tired and I'm pregnant. And so the pediatrician and I are trying to have a conversation, and the 3.5-year-old is literally the Tasmanian devil. She's bouncing off the walls of this very small little treatment room and, look at me, look what I can do. Did you see what I did? Just that very typical toddler behavior, but on a whole nother level. And this most conservative pediatrician in the entire world, he looks at me and very calm because he sees that I'm a little distraught because he and I are trying to talk. I'm pregnant and tired, and then she's doing her thing. He says, Lucy, I don't want to label her, but we might want to watch her for ADHD. And I'm like, what? She's 3.5. So that was, when the first seed was planted, that maybe what was going on here was more than just a very active, very verbal, very stubborn toddler. So fast forward to kindergarten. And so this child of mine has a late birthday. She's just turned 5 because she had her birthday in mid-August. So that's of concern. And so I'm that overprotective, kind of terrified first time mother of my baby going to kindergarten. And so I tell the kindergarten teacher what the pediatrician had told me previously. And she did probably what any kindergarten teacher on the planet would have done. She said, you're fine, she's fine, go home. Everything will be fine. And I'm sure any kindergarten teacher hearing this would go, yeah, that's exactly what I would have told that mom, because you're nervous and you're distraught. This is your baby. And I can appreciate that. I'm not mad about that. So I did what she said. I went home and life started and kindergarten started. And, you know, by what we were observing on our end, as far as, you know, what was happening at home, it seemed to us she was settling well into that new routine. But at the end of the first grading period, I get the phone call. And so I'm asked to come in, and then it all comes out about some of the difficulty they've been having with my daughter and behavior, and just can't keep her hands and feet to herself and all of that. And so we proceed then down the journey has started of the parent questionnaire, the teacher questionnaire. We get all this from our pediatrician. Our pediatrician sends us to a medical psychologist for our daughter to be evaluated, which I really appreciate. He sent us to someone who was an expert, which I can't speak enough about how important that is. So we had like thorough testing. And so all the information comes back, and your daughter has attention deficit hyperactivity disorder. And I mean, I think on some level, as I was especially going through that parenting questionnaire, I feel like I probably knew that. And again, I'm wrestling with my own feelings about that. It's so hard to be objective. This is your beautiful child you would lay down your life for. And someone is telling you something's not right with your child. I mean, that's super difficult to hear. And so I think at that point is when discussion about medication began. My husband and I were both, I think, kind of on the same page at that moment about that. We had reservations. She's 5, and these are brain-altering medications. They're stimulants. You know, I knew enough to research that and learn about Ritalin, and because that was what was available at that time. And it just made me nauseous just to think about, I'm going to give this to my baby. But I wanted to help my child too. I wanted my child to be successful. I wanted her to thrive in school. This was a good school. These were wonderful teachers. I have nothing but good things to say about where she was. That wasn't the issue. She was different, and she was making the teacher's job a bit more challenging, and she was also alienating her peers. That was part of our discussion, was her own feelings about her experience in kindergarten. And I was very aware that that's an important time, and you want your child to adapt well, and you want them to feel like they have friends and that they fit in there, and you know that they're saying all this to you when they come home. So it was just like I'm kind of like feeling some of that same feeling just talking about it with you right now. But we did ultimately decide to pursue the medication avenue, but not before my husband and I went in and had a face-to-face meeting with the pediatrician, like sitting down in the office and talking about it, because I was the researcher of the two of us, and my husband and I, and I feel like he and my daughter's temperaments are just almost perfect, like the same. She's him, but in female version. So it's kind of funny now looking back in hindsight, because he wanted to tell me things like if I would just get up earlier in the morning, that all of her issues would magically disappear. And I'm like, well, hold up. You're the one who was telling me in 3rd grade during standardized testing, you were sitting on the floor in the back of the room cleaning out your desk, while I was blowing the Iowa Basic Skills test out of the roof in my little Catholic elementary school in Little Rock, Arkansas. So you keep that. But we made it through, and we decided to start a teeny-weeny dose of Ritalin. And the doctor said, if this is not her issue, if the issue is something else, a stimulant isn't going to help. A stimulant in a child like this, and with the way their brain is wired, is going to actually have a calming effect, and you'll see that in the behavior. I mean, it all sounds really great and good, but it's still your child. So like we prayed over it and vomited over it and cried about it, and then we were like, we're going to do it. So I'll never forget, the day we gave her the medicine, and I was driving, sporting my 1989 Dodge Caravan, and I pull up to pick her up, and so I think the teacher approached my car and opened that side sliding door, and I look over and I'm just, I'm waiting for that, and I got that. And so my daughter gets in the car and off we go home. So the medicine helped, but it wasn't the whole answer. And that's really what I need you to know about my journey and with my child, and then what I have observed in other children that I've had the opportunity to help with my particular more comprehensive, holistic approach to this, because it's not just an issue. So if it is a brain chemical issue, then I would say, as the root cause girl, where's that coming from? Is it environment? Was she born that way? Is it something she's eating? Is it a nutrient deficiency? Yes. Yes. All of those. And then some. Yes. So what I think is important for you to know is that the traditional approach to this is extremely one-dimensional, and it's not always 100% successful. And so we have to ask ourselves, where are we missing the mark? And so I feel like that's what separates me in the way I approach this, not only as a mother, as a parent who went through this and did some things well, but certainly would like a do-over, because I just didn't know. We weren't talking about it in this way. Functional medicine wasn't a thing back in the early 90s. Certainly not in Ruston, Louisiana. So pretty much we were dependent on our pediatrician to give us guidance, who gave us the best guidance that he himself had. But we know better now, so let's do better. Let's talk about those root causes. Let's talk about food sensitivities are a real thing. I'm not talking about allergies that cause a hive breakout. I'm talking about intolerances. It's a much more subtle thing, and certainly there's some testing we can do to identify some of that, but really the cheapest and easiest way to approach that is through a modified elimination diet. Then we do blood work to assess as much as we can possibly know about your child's internal environment. How is their thyroid doing? I see autoimmune thyroid disease presenting in kids. So that's not an unheard of thing. What are their nutrient levels? I've seen kids who are extremely deficient in B12, iron stores, and vitamin D. Nobody's checking any of that. And if you ask for it, God forbid you should ask, they're going to tell you something ridiculous. Well, your insurance isn't going to pay for that. Well, that's not really an accurate answer. And then we talk about the environment. We talk about their screen time. We talk about their bedtime. We talk about their physical activities. There's a lot of things that we go into great detail about. But guess what? I'm going to be honest with you. I don't tend to see a lot of these patients for long periods of time. And I feel like I know the answer to that. I don't feel like it's me or my approach. I think the problem, and I'm not saying this in wanting to be judgmental, I'm saying that I recognize it's a problem because I was the mom, remember? The reason I don't see these kids is that the work of everything I just mentioned falls on you. I know that. I'm completely aware of, if we talk about food intolerances, then you are the one that's going to have to cook differently. Or if you're not cooking, you're going to have to start cooking. I'm aware that I may ask for this child to take some supplements. And some kids are super receptive to that and cooperative. Others are really not. And there's all of those dynamics to consider. So I'm acutely aware there's a unique family dynamic with everybody that I meet and visit with and try to counsel. But I want you to know that any change that I would ask you to make and any change that you would attempt to make is going to be extremely valuable in your child's outcome. And I would have loved to know some of this 26 years ago. That's that time machine I was talking about. I wish someone would have told me, you know what, Lucy, your kid might be gluten intolerant. That's a very real thing. Your kid might be very sensitive to anything red, so you need to remove red dye. And oh, by the way, if you give some high dose fish oil, that might really help your child. I mean, these are very simple things, but nobody told me any of this. And as I moved into functional medicine in my practice and began to study this particular topic in that light, I was sad and I was mad and I was like, why are we not talking about this? These are our children. They are our future. And we should like, if we have to cook chicken and make them change their ways and their habits, then I feel like that's a worthy battle. One thing I knew about my child, and I knew it from the time she was very small, is that she required a lot of sleep. It was hard for her, though, to kind of settle down and go to sleep. And of course, we had no screens then. So I didn't have to face this battle that many parents do now, where they've introduced all of that and kids have developed habits and a dependence. And so it would be World War III for you to be like, sorry, you can't have that on school nights or whatever, you as a parent decided, which that's my recommendation, by the way. So I'm super popular with your kid. I didn't have all that to contend with. We just had the wicked television. But I would have to lie down with her and do relaxation exercises to help her calm down and to help her little brain and her little body settle and be able to fall asleep. And it was literally like when she would go to sleep, it's like you pulled a plug. She might be in mid-sentence, moving, and it was like everything would stop and she would be out for 14 hours. So even into high school, I was very strict on her with bedtime, and then when cell phones did come around, that cell phone had to be on my kitchen counter by 9 o'clock. No discussion. And those were things to protect her. Those were things to help her be consistent, because sleep is key in this issue. It's certainly key with every child, no matter what is their deal, but certainly if you have a child that's dealing with ADHD or ADD, their sleep is everything to them and to their success and to their brain's ability to calm down and cleanse itself and to repair itself and be ready to go the next day. So these are all things that I go into great detail with my patients, and I can sort of see, especially when the moms come, I can see the body language, and I know that they're thinking to themselves, I'm the one that's going to have to do all this, and how's my kid going to respond, and what's my husband going to think, and is he going to believe that all of this is real? And so that's why I really prefer at least to have the first meeting with both parents, if that's possible, or if they even are co-parenting, if they're separated or divorced, even that we can still all meet together or separately, just however that needs to happen. But I do like to talk to both parents. And I like to talk with the child, depending on how old they are. Certainly if they're a little bit older, maybe 9, 10 and above, I like to get them involved. I like them to know me and to meet me, and I like to talk about what do you like to do and what do you like to eat, and are you willing to have a discussion? If I say I would like for you not to eat certain things, can I begin to speak into that child's life and establish a rapport with them so maybe they're willing to try. So I want you to know that I see you, Mom, especially, and I know how much you love your child and that you want them to succeed, and you understand, I'm sure, that their education is everything. So that we want that educational experience to be full of joy and full of success, and we don't want them to feel like they struggle or that they feel like they're different, because I know that's a barrier, and we don't want to create that, by the strategies we use in treating this problem. So that's just what I wanted to share today, and that I feel like I have learned a lot. I have a little more clarity on our journey as a family, looking back on those years and seeing that I did some things well, but there was a lot that I didn't know simply because we weren't having the conversation that we can have now about this issue. And that I want to do everything that I possibly can to support parents and to make them not feel overwhelmed or that you failed in any way, because you have not. And, you know, my daughter now will say, well, I ate such and such, you know, when I'm trying to not let my precious granddaughter, you know, have anything. And I'm like, yeah, but I know better, so now I do better. And that's my encouragement to you, is those little changes can make a huge difference. So if you would, you know, if this resonates with you, if you feel like you would like to look into supportive complementary therapies, I'm not saying that we don't ever need to use prescription medication. I'm saying that oftentimes that is not the answer completely. And perhaps some of these other things can be complements to whatever therapy has been prescribed by your pediatrician. So it's not an either or. It's what's best for my child. Who is my child? And who is our family? And what can we do? How can we come together as a family, just like you would if your child received any other medical diagnosis? The family would come together in support of that child. And so I hope and expect and would like to see that same mentality given and the same thought to attention deficit, because it is a situation that affects the whole family. When one child is struggling and not reaching their full potential, that affects the whole family. So it's not just, we're not just singling out this child and saying, oh, well, you can't eat such and such anymore, and the rest of the family is having whatever they want. I worked with a 10-year-old. It was early on in my practice. A mom brought her 10-year-old son, who was actually on the spectrum. He was highly functioning. He was a cute, little nerdy kid, but he communicated very well with me. And she brought him because he had a rash, just a slight, annoying kind of a rash that would come and go on his face. So mom was sitting behind me and to my left, and I had the child on the exam table, and I was, you know, doing my physical exam. And I turned around and looked at mom and I said, you're not going to like what I have to say. And she went, what is it? And I said, you're going to have to take him off gluten and dairy. And she just went. She said, I knew you were going to say that. So on some level, this mom had some intuition about what was going on with her child with this recurrent weird rash and some recurrent upper respiratory stuff. And she just wasn't buying it, you know, that this was just normal for her kid. She was already doing some really great things in the home with supplements and nutrition. So she was a great ally for her child and a great advocate for her child. And we had a really good conversation then about what did I specifically mean about the nutrition changes I was asking them to make. And so I think we probably drew blood that day and then probably got back together again 3 to 4 weeks later, you know, and that would have given them time to implement those changes that I recommended. So when she came back in, she brought the little boy, and he was very personable and, you know, wanted to participate in the conversation. He was about 10, I think, at the time. And she said to me, she said, he went to a birthday party. After, she said, the whole family did this with him. She said, my husband's lost 10 pounds, you should know. She said, I can't lose weight, but my husband, with no gluten and dairy, he lost 10 pounds. So she was, you know, we were laughing about that. So the whole family rallied around this little boy together. And she said, so this birthday party happened, you know, just right before they had come back to me for this follow-up appointment. And she said, the little boy came to her and he was like, Mom, can I have a piece of pizza? And she was like, oh, it's a birthday party, you know. She said, yeah, sure, go have a piece of pizza. And so the little boy eats the piece of pizza, and I think he might have had a cupcake as well. So a lot of gluten and dairy and all of that. So I don't know if it was that very same evening or perhaps the next day, the little boy comes to her and he goes, "Mom, I can't eat that. I don't feel right." And she was just so excited to tell me this, that this 10-year-old child that had been said was on the spectrum had that much intuition and realization of his little body that he felt one way on not gluten and dairy and then felt distinctly different after one exposure. We were both like, we celebrated. I was like, that is amazing. That's the feedback I'm looking for. I'm not unrealistic in that I think this 10-year-old is never going to eat a piece of pizza again. But how beautiful is it that he got in that short time of, I don't feel good on when I ate that. So he got it. And so then it's so much easier for him to continue to make healthy choices. And how much easier does it make mama's job because she's not having to fight? And I don't ever want that. So that testimony to me was extremely validating in that I was like, I knew it. I'm not crazy. Excuse me. His skin also cleared up and he felt better. So to me, that's a win. It's a win for that little boy. Excuse me, but it's a win for the family too. So I hope this has helped you. I hope you'll begin to broaden your horizons when you think about a problem with your child that's attention deficit, and think more about it from a root cause perspective, and that it's a multi-discipline, multifactorial approach to helping your child be optimal. Thank you.